I know you love to collaborate with other clinicians to provide holistic care. Can you tell us a bit about that or some challenges or what kind of work you have done with other clinicians?
Yeah. So I did a lot of work with occupational therapists. The art therapy role was sort of embedded in the occupational therapy team, for better or for worse, it was there. And I guess it was a way of sort of broadening the scope of my practice and theirs. So it was like a way for shared learning. It was a way sort of like through sort of having this shared goal of providing some treatment or therapeutic outcome for a patient, we would work together and sort of combine some of those really beautiful OT sort of like lens to sort of like there's a lot of practical elements to occupational therapy with, I guess, that more abstract way of thinking about things that the art therapy can offer. So sometimes it would be maybe a more OT focused group, but there'd be a nice art therapy style warm up in the group that would set the tone, make people feel a bit more relaxed in the space. Or at other times, the focus was really, it was actually more of an art therapy group, and the OT was there because they had a really good relational sort of like understanding of the space. So they knew
Mm.
the patients a lot better than I did, or they sort of like the certain patients would only come because they were there. There was all these kind of really interesting elements you wouldn't necessarily think of or pick up on before collaborating or combining your skills. So, I mean, look, we did so much collaborative work on the women's acute unit. I think also because that unit is incredibly difficult. And so, if you have a
Mm.
real occupational therapist there, which we do, or I'm not sure if she's still on that unit, um, it was really important for her to be in that space because she knew the women so well. It was so grounding for them, and to have her lens and expertise because she was more experienced than I was. And so I had a lot to learn from her as well. I mean, I guess in a perfect world, there'd be other creative therapists to sort of run groups with. But when you're limited in that capacity, you sort of have to innovate and find ways to collaborate with other people in a way that you can learn, they can learn, and that's beneficial to the patients because. I mean, we are in a multidisciplinary team for a reason. We all have a unique lens to share with the world. So, yeah, I really enjoyed it. It was just like a
Mm.
really learning opportunity for me. Yeah.
Yeah. I remember reading a paper and it had all the different disciplines and was looking at what was more effective. And actually, the end result which came out was the relationship. If
Yes.
you have a good relationship with the client, patient, whether that be chaplain, spiritual care coordinator, OT, art therapist, whoever, psychologist, it's the relationship in that. Um, and then if they do have goals where you do need to bring someone in, you can then have that kind of shared language and trust to kind of open up that communication. And I think that might be really helpful for loved ones to also understand that people can collaborate. So maybe if you're wanting, I don't know, like a medication change, or you're wanting a
Mhm.
wellness or safety plan written up, and that would maybe normally go to the psychologist, for instance, but they might be a really creative individual. An art therapist could help them maybe make a collage to do their wellness plan, or they may just have a really good relationship with the OT. So the OT could come in and help. So you can cross discipline. And I think,
Mhm.
yeah, that's really important. Or maybe someone's just had a really good experience with a peer worker in the past, but they can't officially like do their medication. So you bring a peer worker into that conversation with the
Uh,
psychiatrist or whatever it may be.